So Next has been an organisation, we've been processing health data for kind of over 10 years, so we've got a lot of experience in that. We've got a partnership with NHS England, so we can process data on their behalf. They kind of instruct us to do that, to look after that. They take data security and compliance with standards really seriously. The staff have to go under additional training to access that data. And there's also some sort of security checks as well that NHS England ask them to do. So that's really at the heart of what we do, and it's really important to the staff that we do that. The process to access the data is kind of governed by something called the Data Access Committee. So users will have to apply to that. They'll have to kind of set out the reasons that they want the data, the legal basis, and the work they've done that kind of shows that it's appropriate, it's safe. They've got like different things like ethical approval, for example. So they'll have to present that to a Data Access Committee. That's going to be made up of experts from data and governance backgrounds, as well as members of the public. And there'll also be kind of representatives from health and care organisations who are providing the data. So they'll kind of decide if that application is applicable, and if it is, then the researcher will be allowed to access. We'd really adopt principles of data minimisation when we're sharing the data. We'd really only share what was needed for a specific project. So for example, if something was geographically based, we only share the data, or the researcher would only be applying for data for that particular area, so they only see the cut rather than kind of all of the data, for example, in the North East. We kind of saw with COVID, research happened really quickly, and that really helped with the delivery of the COVID vaccine. At the moment, we've kind of got to go to individual data controllers. That takes quite a lot of time and quite a lot of effort to do, when actually if we could get agreement from organisations to share their data once for this purpose, it removes duplication, it should make things a lot simpler, it should make a difference to healthcare in the North East.